Welcome back, everybody, to the Lady Leader series. We are super excited to have our dear friend Rachel Wall back. She was such a hit with all things hygiene that we were like, we've got to bring her back because we could have talked forever. Who knows? This may even go into part 3 by the time we're done. But I wanted to bring her back on because truly I know in my coaching calls, and Ash, I'm sure you've heard so much too, just the hygiene department is such a big predictor of the success of a practice. And I know for dentists, it can be one of the areas that's a little bit tough to feel like they're making really big gains. So before I jump right in, Rachel, will you do me a favor? Just kind of remind everybody a little bit about your background and kind of what you're doing now.
Sure. So I've been a hygienist since 1991, and for the last 20 years, I have also run Inspired Hygiene, which is a coaching firm that helps develop and elevate the hygiene services, systems, and profits in the practice. We primarily work with general and perio practices. So yeah, that's me. We have a team of coaches that are also hygienists that go out to work with our clients all across the country. So everything that we teach, we also have practiced and also teach, chair side to our clients when we're in their practices as well. And we still do on-site, training within the practice and combine that with virtual coaching too.
Awesome.
Yeah.
So you're very qualified to obviously have this discussion, which I always love when coaches have actually done the position and are very familiar with, like, it's always hard to take advice from somebody who's like, I've never actually done it, or,
Right.
I've been in an office and I've watched it, but it's so different when you're actually
Yeah.
doing it.
Yeah.
Well, I do want to say, if you haven't listened to part 1, I would highly advise going back and listening to it, just because one of the things that we discussed was really being thoughtful when you're looking to hire hygienists, really taking the time to not just hire the first hygienist, maybe hire the first hygienist, but being thoughtful in hiring the hygienists that really are capable of growing into the hygiene team that you're looking for. Sometimes we get desperate and we can throw somebody in that will fill the void, but may actually create bigger problems long term. So we did discuss that. And I would say that that's kind of one of the foundational points that I want to make as we're moving forward. Because for doctors right now, they're saying, okay, I get it. Moving forward, I will really try to look for hygienists, like you guys said, place the ads that really are speaking to that candidate. But right now, I've either inherited this hygiene team, I took over a hygiene team, or I've just allowed some bad habits and I take responsibility for that. So we're going to speak to those doctors right now. One of the points that I think we did cover in part 1, and I feel like, Ashley, this is one of the crux moves that you and I kind of talk about constantly, is just how important preparation is, really in all positions, but as a hygienist, for your hygiene team to be maximally impactful with patients, preparation is really a huge key. I think fundamentally and on a basic level, doctors understand that. Hygienists understand that. It's the implementation of that that becomes difficult. So I want to spend a little time talking about, what are your tips, Rachel, when you're going into an office and you're trying to help hygienists become a team of people who want to take the time to prepare, and then not just take the time, but have it be really maximized time so that they go into a morning huddle really prepared to create a great day. How do you start?
Well, we've got to start first with the why with anything, and it has to be more than, well, we need to prepare so that we can hit our production goals, right? That might be the ultimate outcome in addition to patient care that you're hoping to see, but we can't start there, or very often we get shut down. So I think we have to start with the why. I think it also has to be a team-wide initiative. It can't just be hygiene. So everybody on the team has to participate in that preparation and lead by example. Whether you are a practice administrator, you're a practice owner, whatever it is, you've got to be involved in the preparation, or at least be there at the huddle when the team is delivering the information and hearing it and then doing something impactful with it. So you don't ever want this effort to just be kind of be seen or perceived as busy work. It has to be something that we're really using and putting into place. So I think that's the first place to start, is collaborating with the team. And you might say, hey, you know what? I feel like our days are reactive. Is that the patients are showing up and we're just kind of reacting to how they're coming at us, where I think we could really have more thoughtful days, give our patients better service, have less stress if we spent some time preparing for our days as a team.
Yeah.
And so first, let's talk about what would we need to to be able to, when the patient sits down, know what has been proposed as far as in the past, how they presented in the past, what's been proposed as far as treatment, and what we might be presenting today, knowing that the patient could present with something completely different and we might have to change gears, but just being prepared and ready for that, and getting the team to contribute to what is the information that we need to collect, because we can spend a lot of time on preparation. And that honestly is one of my things that I always struggled with, was where is the line that you stop, right? Because it can just become this research, kind of black hole of how much do I need to know about each patient? How much time do I spend? So, but if you could find just 3 or 4 things, for the patients and what's really going to be impactful, I think that's helpful. And then the team feels like they're contributing to how it's really being put together. And then creating a checklist on what we're going to do. And it could just be a running list for the 7 or 8 patients that I have on my schedule today. It could be I print out the schedule and I just make notes beside it based on these 4 or 5 things, 3 or 4 things that we're going to identify, and then figure out how are we going to share that. And I think the huddle is a great place to do that, as long as, again, it's impactful and it's not just becoming rote, because that happens a lot too, where we're just kind of repeating the same thing because it's just like this kind of mantra that we have every day. So I think getting out of that might breathe some life into the huddle as well. What's your experience with that, Summer?
Yeah, and that's, actually I was writing down, I mean, I take obviously very similar the approach of it's never just a hygiene thing, it's a whole team thing.
Yeah.
And for us, it's like, here's the 6 optimal care pillars.
Yeah.
How do we all come prepared to deliver these pillars of care within our column?
Yep.
So everybody has a prep sheet. It's not just the hygienist.
Yep.
And with that, I agree. I love that you were saying you got to know the why. You can't just come in and say, do these checklists so that you make more money.
Yeah.
Or I need you to be more productive.
Yeah.
For us, it's the same thing. It's really like, here's the why. This is what we're trying to do. And taking some time to prepare is really going to help you have maximum impact with your patients on that day. And then, for us, it's the same thing, that if we're going to go into the meeting and we're going to, present this info, I find often it can fall flat if there's no implementation after. So, I just sent Ashley kind of our little morning huddle checklist. And much like you said, it's so simple. It combines the morning huddle on the front or the very top of it. It just has end of day kind of stats in the middle, and then a checklist at the bottom of like, turn off the pumps and everything. One page, they laminate it and they just bring it every day to the huddle, and it's their entire day's sheet.
I love it.
Much like you said, it's super simplistic, but what it also does is it can get the whole team involved, because it's like, hey, TCs, I think I'm going to be presenting a treatment plan for scaling and root cleaning here. Can we make sure that that treatment plan's ready to go? And I even have hygienists who are like, I'll just present it myself if you just make sure it's correct. Stuff like that can turn same day into, just that 1 to 3 teeth quadrant. It makes it so much faster than when it's like in the moment, oh crap, can you get that treatment plan ready? And they're trying to check insurance. So I would say morning huddles can be so awesome and productive, or they can really fall flat. But I'm always like, gosh, if we got up early, we all got our bums in the chair, you did all this preparation, like, let's make it count.
Let's do something with it. Yeah. And that was one of the things in the preparation that you sent was, how do we then take action, or how do we have accountability around the information that we provide and what we do with it? And I think that's it is, for example, if it's, we're going to be representing the upper right. That was what we determined was the next stage of treatment. And as long as everything else is feeling good and the patient's, that's what I'm going to be representing today. And then the practice administrator, the TC, then can expect that to happen. And then if it doesn't happen, hey, tell me about Mr. Jones. What happened? I know we were going to talk about that upper right. Oh yeah, well, he's actually having a lot of pain with that crown we did on the lower right. And so doctor came in and adjusted, and we're going to reevaluate and follow up with him in a week. So we have a plan set in place for that. I think it's good too to every once in a while remind each other of why we're doing this and how it relates to the vision of what you're trying to accomplish, like you said. So in what you're trying to accomplish from like a contribution standpoint with patients, but also your goals for the practice. And so if you have, let's say, a new patient goal, taking really great care of your existing patients and asking them if they have family and friends, that helps you reach that new patient goal. Making sure that your patients wait as little as possible helps them refer you to their family and friends and helps you hit that new patient goal. And so the other thing that's nice is we can see in the day where we might get jammed up and where we might be able to might need to ask for help and say, hey, I can present that treatment plan if when this patient comes, because they're always early and I know they need X, can you seat them and start an FMX for me or whatever it might be. So it also gives the opportunity for pre-planned teamwork and where we can really help things, move smoothly through the day.
And that's truly the pre-planned teamwork. That's what I love. And I always say, I don't want to high five inefficiencies. Like sometimes I hear teams rallying and being like, oh, we made it through the day, guys. They didn't add any production. All they did was high five that like we made it through multiple columns of inefficiency. And I'm like, I don't mean to be mean. I mean, yay, you didn't complain during it. But I'm like, what I would rather high five is we actually were able to add that treatment that day for that patient and still get the other one back on time. So I love that. Like that is so important, I think, is, when we're going to have those teamwork moments, what we're really celebrating is we were able to actually help that patient get healthy today.
Yeah.
That is really what we can celebrate, not the hygienist keeps, running late time after time after time.
And we survived.
And we survived. And that's literally like, yes, we made it. Let's go on margaritas. And I'm like, well, sure, if you would like to do that. But I'm like,
but how about we have margaritas to celebrate like a really good day rather than just to get
surviving.
The margaritas are going to help us get to tomorrow, right?
Yeah.
So I was at Hinman a couple weeks ago and I taught a class called Surviving to Thriving that I had taught during like right after the pandemic when things were still virtual. And so that was kind of part of the gist of it was how do we go from just running the schedule and making it through day to day, because then those become the team members that are just waiting to retire or they're looking for another career. How do we turn that around? And a lot of times it is simple things like being prepared, before the day starts so that we don't feel like we're constantly just like spinning our wheels or just trying to keep up.
Yeah. And that can become really the next morning's we have gratitude every morning of something we celebrate.
There you go.
That to me is really what can be celebrated for that next day. And a lot of times that's what I do here. Like, hey, yesterday we were able to pull together and, fit in whatever. And she was so happy. The patient was so excited to get that done. To me, that's like, how do we edify those moments and really make, I think, our team feel great is that. So, the holding accountable part, I think another comment, and Ash, I would love to hear if you caught this too, was she said, doctors, it starts with you. Owners, leaders, it starts with you. Like you've got to be present. You've got to be prepared. You can't just come in and like hang out and do nothing with the information. Did you catch that too?
That was like what I was focused on was like, yes, exactly. Like you can't just expect your team to show up all prepared when you're not setting the example. I had a call with a doc and they were just very scattered and like, oh, my team's just not getting it. And I'm like, yeah, but I need you to take a breath and like read through what we just talked about. Like, I need you to, like it starts here. So like, if you're going to be calm, that's what trickles down. So exactly that.
Yeah. Yeah, so if you're coming in on two wheels, and it happens to all of us from time to time, but it's
Sure.
consistency, right?
Mhm.
You've got to consistently be there for the huddle first and foremost. Like, be there, be on time. If you want your team to be on time, you have to be on time. And then be ready to receive what they're saying, fully present. Okay, that's awesome. So, what is the plan? How do you think we can move things? Like, just be engaged in that, even if you're not doing the preparation. But there are other things that the team sees that the doctors do, where, you know, if they're checking to verify that cases are in, or if they are calling patients after, procedures, or they're calling new patients, is that happening consistently? Because those are just little leadership things that they see and that they watch, and all of those things are preparation too.
Mhm. Our doctors all have morning huddle prep sheets as well,
Yep.
and because I feel just as strongly that it's like, gosh, we've got to be able to come in and be just as ready as we would expect our team members
Mm-hmm.
to be ready. And
Yep.
it's like, gosh, if we can't do it ourselves, I almost feel like, how dare I ask somebody of that which I won't be
Right.
willing to necessarily do.
Right. Right.
And like you said, consistency is what matters. We all have those moments,
Yep.
but gosh, it kills me when like the doctor keeps showing up late or just completely disengaged even.
Mm-hmm.
I'm like, oh, how it's
Mm-hmm.
so hard to then expect that from a team. So
Mm-hmm.
I think
Yep.
accountability, to kind of put a fine point on preparation, introducing it, and holding accountable. It starts with the doctors, it starts with the leaders, it starts with everybody being involved, and then coming to the meetings with consistency, expecting it from each other, and
Mm-hmm.
then really
That's right.
celebrating what the next day, celebrating what the win was from those preparation
Yep.
moments. I think, but I would say for our offices, that's always the most important part. Well, I'm going to kind of change. The next question that I get often is, my hygiene department, I think the perio percentage is low. They should
Mm.
be talking more about perio. So, I'm sure, and I have too, you've looked at offices, you've looked at tons of statistics of hygiene, departments. What do you see as, one, what are the percentages that are usually healthy, and maybe what are percentages that you in your head think, there might be a little bit of missed opportunity?
Yes. Okay. So I would say a healthy perio percentage is around 30-35%, as long as there is a blend of active therapy, so scaling, root planing, and periodontal maintenance. One thing that we see a lot is, and I will say that even in those teams, they often have room to grow still, and sometimes it is with adding adjunctive care, or maybe they're at 25 or 30% perio when they look at their analytics, or they use our calculator tool, or whatever it might be. But then when we break it down, it's being carried heavily by perio maintenance. So you want to have a blend there. I will say the other end of the spectrum that we still see on a regular basis with teams that, or practice owners that call us and say, hey, we need some help, is single digit perio percentage. So what we know is, yes, there are differences in demographics from, retirement community to a college town, but periodontal disease, the prevalence of periodontal disease is such in the US that it's not realistic that only 3% of your patients have periodontal disease. So what I find is there are multiple reasons why those numbers are low, or they're not consistently like hitting those high perio percentage numbers. And one is there's no clear system, right, of how to do it. And sometimes people get confused. And there was a new code introduced, right, for gingivitis therapy about 3 or 4 years ago. So then people got confused about that. And sometimes that code is being used for early periodontal disease treatment instead of
Mhm.
gingivitis treatment. Um, and then, so there's not a clear system. Maybe there's some confusion around, what do I do first? If they have localized disease, do I treat that first, or do I bring them back for therapy first? No standard of care that determines like a threshold of, when we see this level of disease, we recommend something other than a prophy, or we move the patient from perio maintenance because they're no longer stable back into active therapy, or we refer them. Um, I think sometimes that the hygienists feel guilty or bad about recommending therapy because they feel like, man, I should have probably recommended this a long time ago, or what is my patient going to think now? Um, Sometimes there's nowhere to put it on the schedule and there's no time reserved for it. And so hygienists think, well, gosh, even if I did treatment plan this, I can't even get this patient in for 3 months. So I'm just going to do the best I can today and check it next time. And then that next time never happens.
Mhm.
So there's a multitude of reasons. There's also inconsistency often when there are multiple doctors or multiple hygienists within a practice. Of one will be like very proactive, and then the others maybe aren't comfortable with that level of proactive diagnosis, or sometimes they even wonder like, okay, so are they overdiagnosing? And it's just all because there's no clear standard of care and no consistent processes.
Mhm. Yeah.
So I would say all of those things are fixable. And we see dramatic results with teams when they really do come together. And again, focusing on the why. The why is because we know that active infection of any kind is going to increase a patient's risk for heart attack, stroke, type 2 diabetes, some cancers, all kinds of things. I mean, the evidence of some association is really undeniable at this point, in my opinion. And so I think if we start there, which is what we do, is we start there and say, hey, look, guys, we have a responsibility to our patients to tell them if they're not healthy. And here's how the AAP defines health. How do we define health? And it's their choice then if they want to do treatment or not, but we have to tell them what their options are and that they're not healthy. And so that's the first step because we have an opportunity to make an impact on their overall health. And then the next step is, all right, okay, so what is our threshold? When do we start having that conversation with patients? And then what do we do with that? How do we present it to them? How do we sequence the treatment? How do we code it? All of that. And all of that then ultimately results in the perio percentage. The way that we calculate it is a simple mathematical formula that compares adult prophies to the number of scaling and root plantings and periodontal maintenance over a period of time. And different analytic systems calculate it slightly differently. What I have found is that most consultants and analytics are within probably 5 points of each other. They're not that different. Some calculate it based on production of those procedures, some on procedure count. But I'd say if you're in that 20 to 30% range, that's not bad. Just look and see how much of that is actual active therapy and how much of it is periodontal maintenance. Because patients can then get into periodontal maintenance and then they get stuck there.
Mm-hmm. Mm-hmm. Gosh, there was so much good stuff in there and so much stuff that I just wanted to like amen with my one good hand. But I was like, I think some of the things that I see is there's just no standard period.
Yeah.
And that even comes
Right.
down to like, I've seen hygienists all using different probes, all using different stuff. And
Yep.
I'm like, well, no wonder y'all are getting different,
Yes.
readings and things like that. So sometimes, we were just redoing some onboarding videos and I made them go back through and say, okay, this is what probe we're using. This is how we angle
That's
it.
right.
This
Yep.
is, just simple things like that. Just standardize all of that all over again. And if it's at that 0.5, do you guys want to round up or down? I know
Right.
it sounds crazy, but hygienists in general are just usually that kind of brain.
Yes.
And they want to just know what to do.
That's
So I
right.
think for the most part, it's not that they don't, either they haven't been presented with the information, which I agree with you is almost overwhelmingly convicting with the systemic link. They haven't either really been presented with it by chance or understand it fully. There's been no system around it.
Yep.
We also use the AAP, and literally that's our onboarding packet of this is what we follow, this is what we believe very strongly in, but they haven't been given that. The other thing is often they haven't been given the tools right in their operatory to make it happen quickly. And I find if their state allows, if they don't have the anesthetic, they don't have whatever adjunctive tools they need to use quickly to turn it, they're not going to do it necessarily. And what I find is a lot of times hygienists, if they understood, had everything prepared, their rooms were stocked, The TCs were ready with the codes. The
Yeah.
office as a whole was perio ready, if that makes sense. Like
Mm-hmm.
if they were perio ready, they would do it.
Yep.
But most of it is just, and I hate to say this, but it's almost like it's kind of inconvenient sometimes. And so they're like, ah, I'm kind of
Mm-hmm.
stressed out trying to make this all
Mm-hmm.
fit. What if I just
Mm-hmm.
try to hurry and just get it done? I'll do the
Mm-hmm.
bloody prophy, I'll figure it out.
Yep.
And it's just because of all of those steps. So sometimes I tell doctors, you're going to have to step back for a second and really dissect the information, create a system, including what probes, give them
Yep.
what they need in their rooms. And is your front office ready to be able to present these treatment plans, well, and do them quick? Because if
Yep.
not, then that's just as much of the holdup as
Mm-hmm.
anything your
Mm-hmm.
hygienists, may or may not believe. Anything on that point from either of you that you would say?
I would say 100% wholeheartedly agree. And there are a lot of steps there, which is we can help with that. If anybody chooses to do that, happy to chat with them about it. But yes, and also having the treatment coordinators just have a very clear conversation with the clinical team. Is like, look, guys, we've got this. We believe in what you do. We believe in what you're presenting. And so we can help the patients figure out a way to work this into their life. We can figure out the codes. We can work together with you on all that. We just want you to present to the patient what you feel like is in their best interest so they can be healthy. And if that is really laid out clear, and the TCs do feel empowered in that way, and there are a lot of resources for that, then it does take weight off of the hygienist. I would say the other thing that perio ready also again is having the schedule prepared so that there is room for those patients to get in for that treatment. And then also having a plan, a game plan for how do we have the patients involved in the diagnostic process, because we take intral photos for restorative, right? And they see it and they're like, okay, all right, I get that. There's a big crack, or I'm missing half my tooth. But a lot of times with perio, all this information is just collected in silence. And then all of a sudden somebody, maybe it's a dentist, maybe it's a hygienist, kind of drops the bomb on them, is we can bring them along through all of that and have some verbal skills and communications before we ever do the perio exam. And then how to talk to them about, hey, what's changed? What are we seeing differently now? Why are we recommending something different?
Yeah. And a lot of times, I say you have to practice the verbiage, because
Yes.
I know it sounds crazy, but I've had hygienists for 10 plus years. They've been in hygiene for that long, and they've been seeing those patients. And literally the thing that was stopping them is, I don't know how to say to this patient, I've been
Yeah.
seeing you. So I've literally had to say, let's role play this out.
Yes.
Bob, and we literally role played it out in our meeting.
Yep.
And it sounds
Yes.
crazy, but sometimes it's something as simple as that that's stopping them. They just don't know what to
100%.
say.
That's probably the number one question we get is like, how do we tell these patients we've been seeing for 10 years? So it's interesting to me, but I get it because I've been in that position before. But if you went to the doctor and they didn't tell you 2 years ago that you had high blood pressure, but they tell you today, I wouldn't blame the doctor, but for some reason we feel like it's our fault. So a lot of times the team has talked to the patient about flossing more, coming in more frequently, using a Sonicare, whatever it might be. And then if those things aren't working, then we can go back to all of that and say, hey, look, we've talked about and we've tried all these things. We've tried to be as conservative as we can, but your body's not responding the way that we had hoped, and there is still active infection. And that's not okay. And so it's time to do something different to address that active infection. And sometimes just giving them that is like, oh gosh, okay, I can do that. And then the other thing that you can do is you don't have to, it doesn't have to be like a 180 turn on day one. And now every patient, you're presenting treatment to, you could say, hey, again, this goes back to preparation. I've been seeing, Mr. Jones for 5 years, and every time I see him, he has bleeding. So today I'm going to do a complete periodontal evaluation. Can anybody help me with that? And I'm going to present treatment. And I'm starting with one patient in the morning and one patient in the afternoon. And then you get some confidence and some success. And he's like, well, yeah, I'll do that. And then all of a sudden now we can, you start with those kind of obvious cases, and then you can work into the more, earlier stage patients.
Yeah, absolutely.
Hey, Rachel, quick question too. Do you ever have do your hygienists ever struggle with too? I mean, they might be giving the information, but it might not be landing.
Mhm.
And I guess what I mean too is like my hygienist I was seeing here, she was telling me about my pocket depth. And I was like, I know what that means because I hang out with dentists, but I'm like, I feel like
Pockets. No, I don't have deep pockets. That's me.
I'm like, so fives are good, right? Like,
It's
Yeah.
a 10
higher.
is great. No, I'm the higher.
Yeah.
But is that something that you guys
Yes.
assist with and guide with too?
Yes. Yes. Absolutely. It's kind of, there's a whole, like process of how we collect the data, how we get calibrated, how we're presenting that to the patient. And yeah, I think that's true with any kind of languages. How does it sound to, the lay person? And, using those terms like active inflammation, active infection, bone loss, things like that, bleeding. Often we're afraid and we're saying, oh, there's a little bleeding. No, there's bleeding. There's either bleeding or there's not bleeding. So there's just bleeding. And if you want to use a modifier of heavy bleeding, and there is heavy bleeding, fine. But anytime we put little or just or, that kind of thing, it minimizes all of it. So yes, all of those things add up to patient acceptance and what the patient really gets. Yeah. What are they getting it? And
Yeah.
then how do we then communicate that to our doctors so then doctors come in and support that? Because doctors have a huge role in the success of the perio program within the practice, right? They've got to I say you must be the clinical leader. You cannot abdicate that role. And do not, you can empower your hygienist to the very width and breadth of their, or depth and width, well, I don't know what I'm saying, just
All
scratch
of
that,
Yep.
all of their license. Right, you can empower them to the full extent of their license, but you still have to be the clinical leader, and you're ultimately responsible for all of that. And so be that and say, hey guys, we've got to have these standards, and it's just fair to our patients to tell them what's going on with their health. And so just having the doctors really be supportive, and also empowering the hygienist to communicate that information when they come in for that handoff. I always teach hygienists, I say, you are running that hygiene doctor exam. This is your show, and you are there to really communicate to the doctor what you and the patient have discussed in front of the patient, and also communicate to the doctor what was the patient's response, like they understand, they're ready to get this taken care of, or hey, Rachel has a few more questions, whatever that might be. And then doctor can just be the bobblehead because you've already agreed on all of your parameters for care, and can say, yes, I agree with that, and this is a really important first step before we address your smile design or your whatever that might be.
Yeah. Well, and I love, by the way, one thing I hear doctors sometimes do, and I get it. I believe that what they're trying to do is really just show the patient and the hygienist how much trust they put in the hygienist by, not like, they won't even say the words like, this is super important and I completely agree with Amy. Instead, what they'll do is they'll go, yeah, just whatever Amy says. And I'm like, nope, nope, nope. Like, you've got to say, absolutely, Amy, I couldn't agree with you more. That is such a super important part. We've got to do that first.
Yes.
It's all they have to hear, but they can't just hear you say, yeah, whatever Amy says.
Right.
It almost just seems like you're abdicating responsibility.
Yes. Or you're trying to get out. Yeah.
Yeah. And I'm just like, no, it's got to be just as important to you as it is to them. And I'm
Yeah.
like, unless you don't believe perio is important, like doctors, you got to go in and say more than just like, whatever they say, And I'm like, I know what you're trying to do, and I do get it. But I think to a patient, it almost then can be perceived as not that big of a deal. Amy wants to do it. And I'm like, no, as a clinical team, we want you to get healthy, I think.
So I think that's a really great point too, is Amy wants you to do this, right? Or Dr. Summer wants you to have a crown. The patient really doesn't care what you want.
Yeah.
Right? Well, yeah, Dr. Summer also wants to go on vacation, and maybe this crown is, getting her half the way there. I don't know.
Yeah.
But it's weird, the things that happen in patients' minds is this is in your best interest. We
Mhm.
recommend this for you and for your health, right? It doesn't have to do with what I want to do, right? If I just want to have scaling root planning, next Tuesday. No, this is about the patient and their overall health. It's not about what I want. So now I think, to your point, if you said we want health for you, um, I think that's great. They have to want health for themselves too.
Mhm. Yep. You're never going to talk somebody into valuing that which they don't value.
Right.
You can present all the information,
Yeah.
but as like Ash was saying, like you can do it with words that hopefully will land the best. And we're always trying to work
Hmm.
on, did we land the plane? Because that's all we care about.
Hmm.
They can take that information and do whatever they want with it, but do they understand? And if they understand it's active infection and inflammation going on in their mouth, if they
Hmm.
understand that and they choose nothing, I at least can walk out of the room feeling better, knowing I at least gave the choice. But
Yeah,
sometimes I
exactly.
think when we dance around it, or we potentially are like, hey, just do whatever so and so wants, it may just minimize to some extent really the severity of what's going on.
Hmm. Hmm.
And like you said, you don't go to the doctor, and I didn't have, a little hip dysplasia, and you can throw a wooden
Right.
towel in there if you want. You can, not do anything. Like really, it was like, hey, this is
Just
what's
limp around for a while. Yeah.
happening. Yeah. You
Right.
and I think much like you say, I equate everything back to the medical community, and I'm like, there's no way. Like when I just went in with my hand, there was no sense of like, it was just very like, hey, here's what you need, and we're really
Yeah.
concerned, and this is when you need it. I could have
Let's
said
get it
no.
scheduled.
Yeah,
Hmm.
you know,
Yeah. You could have
but
said no. You could have gotten another opinion, but they were very direct and clear with you. They probably showed you what was going on.
mhm,
And yeah. And so I was just um, at Hinman, as I mentioned, and I taught several new courses there. And one of them was this course that I developed with a really amazing hygiene, I'm just going to say icon, because she was one of the first really to start teaching a lot of these verbal skills and things like this many, many years ago, Chris Duval.
mhm,
And we taught a course called Life Saving Screenings. And one of the questions she talked about, high quality questions versus low quality questions. And
mm,
low quality questions typically are the yes or no questions that
mhm,
kind of close the door on our conversation. And so one of the things she said, she asked patients is, what do you want for yourself and your health?
mhm,
So, you're here at the dentist. What do you want for yourself regarding your dental health, regarding your overall health? And, I listen to patients, and when they talk about their grandchild and they want to be there for them, and that's why they're trying to lose weight or get their diabetes under control, like all of those things are cues for you of this patient values their health. And so if I can present this in a way that's going to support what they're trying to achieve with their health, then it's going to be very personal to them, and it's going to make sense and be valuable to them. But sometimes it's just as blatant as, what's most important to you with your overall health?
mhm.
What do you want for yourself and your overall health?
Yeah.
And sometimes it's, I just, well, I don't want to have pain,
Mhm.
you know? And so then we can address that. It doesn't mean that's the only thing that we offer them, but we can figure out a way, if we think critically and we really take time with our verbal skills, to speak to what is important to them.
And I think we gloss over. It's funny. I must have heard that because I've been in dentistry so long. I must have heard that because that's actually exactly what we say
I
is,
love that.
tell me what matters the most to you. Like for your oral health, what matters the most for you? And it's often how much they're
Hmm.
like, I don't even know what you're talking about. And we have to tell them, do you care about the aesthetics? Do you care about keeping your teeth for a lifetime? And they always laugh because they're like, well, of course I want to keep my teeth for a lifetime. And I'm like, you'd be surprised. Some
Right.
people, their grandparents lost their teeth when they were 50, you
Right.
know? And so they're like, no, no, but it's funny how if all you do is just ask better
Yep.
questions,
Yep.
what I find is the minute they start talking, they tell you what they value, and they tell you
Hmm.
to the extent of dental knowledge that they have. They
Hmm.
tell you what their history's been. They tell you
Hmm.
that they want to make a change, but they don't know how sometimes.
Yeah.
So I just think
Yeah.
sometimes we want to gloss over that connection piece with a patient. And that's really the ticket to like everything. Like that's the ticket that tells you everything that moving forward is going to matter
Hmm.
to them.
Hmm.
And kind of like you said, there's no sense suggesting treatment that they're never going to value in the first place. But sometimes they don't value it because they don't even know. They
Right.
don't even understand that
Yeah.
they just said that they actually do value health. They didn't realize that that crown meant health. They
Right.
just heard
We have to
money.
connect the dots. Right. It's
Yeah.
our job to connect the dots for them. Yeah.
Yeah. So I think that's such a valuable thing is you can figure out just by changing your question in the very beginning and having all your clinicians start there. And it takes patients by surprise.
Yeah, and it's even little things like instead of saying, are you having any pain or discomfort? So if they say no, they've kind of closed the door on you recommending any kind of treatment, because a lot of people just think, well, if I'm not having any pain, then I must not need any dental treatment. Everything else is just elective, right? So if we ask them that question and they say no, we've just kind of closed the door for ourselves. And oftentimes, that's the first thing that question that's asked at a hygiene visit.
Is do you have any pain or sensitivity? And
Right.
what's nuts is really what that's saying is you really shouldn't need us unless you have pain or sensitivity.
Right.
Oh,
Right.
you literally just negated everything
we're going to say
Yeah.
at the very beginning of the appointment.
Yes. I'm like, no, don't.
And right. And then all of a sudden now it's like, no, I'm just here to get my teeth cleaned. Now all of a sudden that's really all that they value. So we talk a lot about that hygiene exam that happens before we pick up the scaler and how we screen for blood pressure, oral cancer, airway, periodontal pathogens and active infection, maybe even periapical abscesses on radiographs. Like, think of all the things that are done before we ever pick up the scaler if we're doing that hygiene, exam first.
Yeah.
But yeah, I hadn't thought about it that way, but that is exactly what happens is we get all of that down with that very first question.
Yeah. Well, and it's like,
we open it all up. Either we shut it down or we just open up the whole conversation. Yeah.
because when you find those perio pockets and all the signs of perio, you now have to tell them that a disease process that's completely silent that you won't feel, you need to treat.
Yeah.
And it's like, oh no,
Yeah.
it's a hard thing to have them change on, but it's actually one of the most common things I hear. It's kind of like, do you want fluoride? Well, nobody wants fluoride. They don't know what that means.
Right.
They don't even know what that means. But I'm like, you have to connect. Why would it make sense? And why is that a prescription for you? Like, hey, you've got this, this, and this. Fluoride is the most conservative way to help. It's only this amount. Is that something I can do for you today to help with that sensitivity or whatever it may be? But instead of, do you want fluoride? Your insurance doesn't cover it.
Why would I ever say yes? Right.
But the words we use, I think, like Ashley, you were saying, and knowing you were just at the dentist, like, it's funny, like, to a patient, it really does change the whole experience in the dental office from you being a true, as I tell my hygienist, like nurse practitioner of the mouth, a true healthcare provider, from I provide a commodity. I'm a cleaning lady type thing, just by the words you choose. Well, I'm going to move on because one question that I get all the time, and if once again, we'll probably have to have a part 3, but
I think we will, because we've
know.
got like a whole nother page.
I know, it's crazy. That's why I was like, I'll just move that over. But one of the questions I do need to ask is incentivization for hygienists and a true, like, how do you suggest, does it vary upon, office to office? Tell me what you talk about.
So I'll start by saying that there's no compensation plan that is completely foolproof. There's no compensation plan that's going to be absent of any like loopholes or little workarounds that maybe you didn't think about, because I've seen hygienists get super creative in ways to achieve their goals, and then also in ways to kind of circumvent the compensation plan, structure. So when I say, what I mean is, for example, if the goal is to produce a certain amount per hour, then they will maybe clock out for that hour if they don't have a patient and not help the rest of the team. And that just is a morale killer, because all of a sudden the rest of the team sees, well, they're not team players. They have they have commission or they have an incentive. And so they're really just here to I mean, they're here to take care of patients, but if they don't have a patient, they're not going to help me. And that just builds resentment. It just doesn't build a healthy culture.
Mhm.
So it's tough. And I cannot say that I have found the exact formula and answer. I think it depends on the practice. It depends on what you're trying to accomplish. I think there are multiple good ways of doing it. I think there are ways that you can have tiered systems where maybe if there's a doctor that's reluctant and they say, I need to know what the maximum cap is on this incentive, then there can be tiered things for production. I think there also need to be rules of engagement for any type of compensation that involves incentives. And I think they need to be written and they need to be signed by all parties involved. I'm not an attorney. I don't think it's an official employment agreement, but there are things like, the patient's care comes first. And here's what needs to have happen. Like, patients will not be moved from schedule to schedule and manipulated. We will not, if there's a patient that has active infection and I don't have room on my schedule within 2 weeks, then it's okay to schedule them on another hygienist schedule. We need to think about what's in the patient's best interest. Treatment notes. I had a situation once with a hygienist that was on commission, and she was fantastic and she was extremely productive. But what we discovered was she was not writing her clinical notes. There were days and days and days where there were no clinical notes. And the reason was because she was so full, she didn't have time to do it. And so that's not okay. That's not an option. And in order for her to qualify for the team bonus, or her incentive was like for everybody to qualify, all our clinical notes need to be done by the end of the day. And, again, I'm sure I miss a clinical note. I know I did here and there, but consistency is what we're looking for. So the things that I have seen what work well the majority of the time are like a base hourly rate or base daily rate. And then once you hit that 3-to-1, there's a percentage of that overage that can be paid out over like on a monthly basis. Okay. It needs to be paid on net production, and it needs to be realistic and doable. And for a hygienist to be able to really embrace it, they've got to believe that it's actually achievable. So before you put that in place, sit down and do some math and really make sure that it is reasonable and doable for them to get some type of production increase. Now, I also think that if we are incentivizing individually, it's going to lean more towards individualization, where the hygienist is going to be thinking more about his or herself. Okay, it's not true for everybody, but it just is kind of the nature of the beast with that. So if there's a way that you can maybe pay them a lower percentage on that overage, but still be included in a team bonus, or maybe you have just a team. I saw somebody actually posting today in the workplace about they said, if we hit this goal, whether it was certain number of Invisalign, we're going to schedule a mani-pedi day for practice, or we're going to go out and have happy hour at such and such. There's got to be some things that everybody is working towards together. One thing, and I just actually ran it, I did not put this in place, but I came across a practice probably 10 years ago. And then I just ran into this doctor recently at another event, and they have a hygiene department of about 5 or 6 hygienists. They model that they all have a schedule. Actually, they have 5 operatories, and patients are scheduled in the operatories, but the hygienists take patients as they are available. So they don't just work in op 1, and the patient in op 2 is waiting while I'm, taking a break or whatever. The hygienist that's ready, they take the next patient that's there, and they all see all the patients. And they have a pooled hygiene commission. They all make a certain percentage of the hygiene production, distributed among all the hygienists. And when they have a new hygienist come in, they vet them, they train them, they bring them up to speed for 3-6 months, and then they go into that pool. And it works really well. And I saw him, he's like, we've been doing this for 15 years and I wouldn't do it any other way. So I think it's how it's presented, how it is managed. I do believe that it's important when you introduce something like this, that the hygienist can easily figure out what the bonus is going to be, because if it's complicated, they think it's not real, and that it's got to be doable. You got to be able to show them a couple like schedule scenarios of this is how this could be achieved. What else do you need? What else do you feel like you would need to support this level of production? And get the hygienist. Well, it would be great to have voice charting, because then I would be able to do that a little bit faster. I really need, new ultrasonic tips or whatever it might be to achieve this. So get some input from them, have those written rules of engagement, and then just always say, hey, look, we're gonna do this like at a 90 days at a time. And we're going to revisit this and see how it's working. And we're probably going to need to make tweaks to it, and just kind of set that ahead of time, and set your expectations of, behavior, and that you want this to be a win for the patients, for that hygienist, and for the practice.
I really don't have anything more to add than exactly everything you said, which is I have never found anything that works perfect all the
100%.
time for
Yeah.
all the hygienists. You're going to have those hygienists who, like you said, work the system. You're going to have the ones that are super team engaged, the ones that are very like in for themselves. I do exactly what you said, literally on a monthly basis, a percentage of the overage after 3.3 times a day. They know exactly how to figure it out. That way it takes into play, if you come early and start working on preparation, you stay late and work in preparation,
Yeah.
it just means you're going to have to produce more. So either learn to be more efficient or outproduce your time, including if they happen to get overtime, things like that. So it really does kind of put the accountability on. From a math standpoint, it makes sense. The only caveat I have found is, the practice has to be healthy enough in all other areas to be able to support that. So overhead wise, I know for me, I've got a certain threshold that if for some reason production and overhead aren't working, we can't continue that program. And I think probably the biggest thing I would say to doctors that I see is they sometimes react out of fear. And so they throw a bonus out, and doctors tend to actually be overly generous, I find. So often they'll try to throw more out in the beginning. And I'm like, wait, put the brakes on for just a second. And let's think through, is this sustainable?
Right.
And is it something
Right.
that, like, if I can foresee resentment coming down the pike for me, like, I better put the brakes and ensure, like, I love, like you said, what are the rules of engagement? You've got to figure those out before, and your team needs to know, like, it's a 90-day trial basis. Here's the rules of engagement, guys. And if you're not a healthy enough practice, don't even suggest a monetary bonus. Do something more like a gifting, like a mani-pedi is almost always mine too, or something like that, or a dinner
Spa
at a
day,
restaurant, a spa day, something like that, because that's so much easier than a monetary bonus, because it does become then part of their almost salary to them. So I would say everything you said, I couldn't agree with more. Ash, I don't know if you've heard anything when it comes to incentivizations, anything like that, that you would have to necessarily add.
No, I think it's spot on. It's just so hard to find something that fits every, it just, it doesn't exist. I don't think.
Yeah.
One shoe doesn't fit all.
Right. I would agree. And maybe mix it up, and do different things for certain periods of time. The other thing that I learned from another consultant that I think it just came to my mind, Sharon Tiger, she said, it's going, as we're doing like direct deposit and all of that, it's going to just become part of their compensation. And then they're going to, base their bills on what's coming in. So her recommendation was put it in a separate check, and hand it to your team member and say, thank you. I'm really excited that I can give this to you because you went above and beyond, and I really appreciate you. And you guys, I have to say, like, we see so many team surveys that come through from our clients. And a lot of times that's the number one thing that team members want, is they just want to be acknowledged and appreciated. Now, I mean, I'm sure they want bonuses and nice, gifts and things like that too. But that means so much more than you would ever imagine coming from their leadership, their practice owners. Is I really appreciate the effort that you put in here. And, you handled a difficult patient today. You were right on it. And I just can't thank you enough. And if you're not the person to remember that, because at the end of a busy day, sometimes it's tough, get somebody on your team to remind you. Or once a month, sit down and like write a note to somebody on your team, that you just really appreciate everything that they've done, or call out something specific if you can, because those little things go a long way. And those are things that also help bond team to you.
Mhm. Yeah, for sure. I do love that idea of the separate check, because you're right. If it goes completely within their one check, they don't notice it. We do at
Yeah.
least delineate it out in direct deposits.
Mm-hmm.
They're going to see different deposits based
Yep.
on, they can see their paycheck and then they can see. So at least for us, we know that it's separate. It's a great idea though, to be really honest, to probably just do the paper check and hand it to them. I love that. And yes,
Sometimes
you're
the
right.
bookkeeping's difficult with that, right? But anyway, I thought.
I think no, I mean, I actually think it's probably not as hard as it may seem. It's just something to definitely think about. But
Mm-hmm.
and I agree, a lot of times just really remembering to, every day, hand out actually specific compliments, not just you're doing a good job.
Yeah.
You did a great job. It's like, I did a great job yesterday. I guess that means great. And one trick I've told some doctors who are the most well-meaning doctors, they're just super usually focused with what they're doing.
Yeah.
Just keep 3/4 on your desk, and you have to get rid of those 3/4 by the end of the day. And it doesn't mean you hand them the quarter, but it just means one quarter. It's just a reminder of something to say
love
that I
that.
gave out 3 things. I gave 3 very specific compliments. Put them in your pocket.
Yeah.
As long as you've changed them to the other pocket, you can be done.
Oh,
But
I love that.
something
That's a
just
great
to
idea.
remind, yourself, to just be able to say something specific. I think one guy told me he put gummy bears, and I was like, "Ooh, did you keep the same gummy bears like all the
I got
time?"
lint. I got covered in lint. Here.
Oh, yuck. Well, I just want to say thank you so much. As always, like, it's just so much fun to have these conversations. And I think, we can all 3 attest just to the power of a really great hygiene team and really great leaders that help empower those hygiene teams. Anything else kind of as a final word from either one of you? Ashley, anything?
You ladies cover so much. I think like you're right. We're going to have to do a part 3, or maybe we're just doing quarterly hygiene webinars with Rachel.
Good.
There's
We
so
can do
many,
that.
so much awesome stuff. So thank you again for being here for sure. Anything else?
I would just say, don't, I know it can be discouraging right now, whether you're looking for a hygienist or maybe you don't have the greatest relationship with your hygienist right now, but it's possible, right, to strengthen that. It's possible to be on the same page. And it just, I would say just start with, focusing on what's working well, do more of that. And then that often opens the door for, okay, then where do we have room to refine things? Where do we have room to kind of, tweak and refine things? It makes it better for everybody. Creates that triple win for the patient, the team, and the practice.
And I will say, from my standpoint, doctors, it's not necessarily going to come from the hygienist, but boy, oh boy, if you can just be the one to put out the olive branch and
That's right.
say, hey, I don't know if I've told you lately, I'm really grateful for how you do blank. This is working so well. And that's it. Don't even continue on potentially that conversation with, can we work on a few things? Then it turns into that whole poop sandwich thing.
Yes,
and
that's
usually
right.
what they're waiting for.
Yes.
So I'm like, maybe just stop with starting to refill the bucket and just start with you. And even if that hygienist is a little bit stinky once in a while, just start with you and give it a try with filling your bucket first. Come back later after the bucket's been filled to maybe have discussions of opportunities to create better appointments. But it has to start, I think, with us doctors to extend the olive branch. So. Well, there are going to be at least one resource. Rachel might have some resources she can post to help us on this little link. And please share it with anybody that could be helpful. Please listen to part 1 if you didn't already. It's super helpful. And then, I think we'll just continue this conversation, ladies, because hygiene is just always a big topic, especially right now. So
sounds great.
Thank you all. Have a great day. Thank you so much.
Thanks all. Bye-bye.
Bye.